I hope you all are staying safe and keeping healthy. A warm and humble welcome to the webinar series by Sharp under Youth and Adolescent Health. My name is Sanika Gupta, and I will be moderating today's session with my colleague, Ms. Shivani.
So a little brief about SHARP NGO. SHARP stands for School Health Annual Report Program. It's a pan-India non-governmental health organization that is working from over 22 years in the field of holistic development and healthcare of students and children. And we at SHARP always try to educate and open conversation on problems related to youth and adolescent during or even after the pandemic. And through this webinar series, we hope to spark discussion on very important topics pertaining to today's youth demographic.
Through the past 2 years, schooling has been conducted online for all students, from pre-primary students all the way up to college. And there is no doubt that it took both teachers and students some time to get used to this new mode of teaching. But the circumstances forced us to adapt and make the most of online schooling. The past 6 months have been rather turbulent as students have returned back to physical school and then had to go back online due to the third wave. And there's no doubt that even as of now, the situation remains largely uncertain. Through this webinar, we aim to discuss the following topics. Should governments reopen schools amidst the Omicron scare? The concerns over school reopening, how ready are parents to send their children back to school, and how ready children are themselves to get back to school. We would like to thank you all for being here today and joining us in this very important conversation. Before we start, I would like to thank all our panelists for taking the time to join us here today.
And on our panel today, we have Mr. Swadesh Saxena, Dr. Jaipal Kapoor, Dr. Neeta Bali, and due to some emergency, Dr. Ravi will not be able to join today. But nevertheless, thank you so much to all our panelists for joining us today. And a few instructions before we start the webinar. We will going to have a small poll that is going to show up right on your screen. So please fill out the poll and it's open for all. And then we will going to have a round of, the poll is right on your screen and it's open for everyone. And we request everyone to please fill out the poll because we are going to discuss about these questions later with the panelists. And as I was saying, then we are going to have a round of discussion with all our panelists, and then we will have a live Q&A round where audience, you can drop your question in the Q&A box because we will be taking up live question, and two best live sharpest question of the day will get a gift voucher worth ₹500 each. Also, we request the audience to not fill the chat box with some unnecessary messages because we may tend to miss out some important questions.
Before we start our discussion, we would like to introduce all our panelists. Mr. Swadesh Saxena has expertise to develop and execute commercial and social projects. His key strengths are building strategic partnerships, building strategic partnerships, marketing, and the finance closures of multi-stakeholder projects. He has tremendous experience in managing core functions and the PLN in companies with driving growth with a society-first principle. Sir has held a crucial management position in multiple places and has been instrumental in managing startups across the corporate, social business, and not-for-profit sectors. He is also fond of writing books about business growth. Thank you so much for being here with us today, sir.
Our next panelist is Dr. Jaipal Kapoor. Sir is a public health professional and pediatrician for over 35 years, and with proven track of effectiveness and improvement in immunization coverage. He rolled out ART for adult and pediatric population as project director of the Delhi State AIDS Control Society. He is also the member of National Task Force for Implementation of School Health Program and NACP. Sir has also launched many different programs for adolescent and children like IFA programs, substance abuse, reproductive and sexual health, Umang, which is one of the free distribution of sanitary napkin program for school-going girls, and launched so many programs for early detection and management of high-risk pregnancy. Thank you so much, sir. We are so glad to have you on floor. Next, our panelist is Dr. Neeta Bali. Ma'am is a seasoned educator with over 38 years of experience in the field of education. Currently, she is the director principal of GD Goenka School, Gurgaon, Sona Road, Haryana. And she is an eloquent speaker, trainer, and has been invited to various prominent educational conferences all over the country. Also, she has a various circular ICSE, ISC, CBSE, IBD, uh, and many other programs. She has also worked, all right, I'm so sorry. She has also worked intensively with the British Council as the British Council School Ambassador in promoting the spirit of international mindedness. Apart from this, she is authored English language book for Frank Education Aids and a book of essay. She has also written several articles for widely read education magazines like Teacher, bought by Australian Council for Education Research and Mentor. Ma'am has been awarded with many felicitation and awards under her name, like Inspiring Educator Award, Uttarakhand Ratan Award, and many more. Ma'am, we are so honored to have you. Thank you so much for joining.
Once again, a huge thank you to all our panelists for taking the time to join us for this webinar. The governments in many states are yet to announce any formal legislative orders with regards to the opening of schools post the Omicron wave, which has significantly affected the population of our country, more so among the youth. Being a student myself, I know that many people in my grade have been affected by the Omicron variant of the coronavirus, even after getting the first dose of the vaccine. So my first question is to Dr. Kapoor, sir. So medically, what is your opinion on the reopening of schools given the current turbulent situation? Sir, you're on mute.
Yes, Sarika, is a very important question which you have rolled out right in the beginning of the program. Believe me, if you go by the scientific literature, scientific evidence which is available with us at this moment, and it also you go out by the demand of the parents, demand of the society, demand of the students, I will say also. I had the similar session yesterday with the Indian Academy of Pediatrics. And to tell you frankly, it was a consensus statement that school should open as early as possible. So if you want me to give evidence, I have a lot of evidence to give to you. But let me make the statement at this moment, all stakeholders, they are in for opening the schools, and we should open the schools.
All right, sir. Definitely, we should open the school. Let's discuss about this further as well. So, as Sanika mentioned, adolescents have been increasingly affected during the third wave. What are some of the precautions that schools are taking, ma'am? If you can take up this question, like what are some of the precautions that schools are taking up at this point to ensure that the return of students back to school is safe?
If that question is directed for me, Shivani? Yes, I'd be happy to
yes,
answer
you can
that.
go ahead.
Yeah. I personally feel that all schools, in fact, as Dr. Kapoor very rightly said, should now reopen for the children, because long absence from schools has very adversely affected the mental and social well-being of the children. And it is important that schools reopen. However, having said that, I think all administrators associated with different schools need to take adequate measures. One, of course, is that you cannot go back to pre-COVID times and clutter the classrooms. You cannot have too many students in a classroom. You will have to restructure the number of students who are there in a classroom, restricting the number of students and ensuring social distancing norms. That is very, very important. Having said that, it is going to change the entire dynamics of the student-teacher ratio, because obviously if you're going to have fewer children in a classroom, you will need to deploy more staff so that you have more teachers attending to fewer students. So the whole dynamics will definitely change. Second, of course, is the seating arrangements that are made in the classrooms. Those will need to change. Third is the sanitization of the school premises, which is of utmost importance. Sanitization of the school premises, not only as a one-off event, not something that happens when children come in, but I think now it will have to become a norm. It will have to be consistent, constant, and will have to be monitored very carefully by the administrators and the managements who run the schools. It is going to be very important. Another very significant thing is educating the young and also the caretakers and the teachers and staff. Of course, all staff must be vaccinated before they return to school and should be able to produce their vaccination certificates. And that's a mandate we have made for our own staff also, that every time any staff reports back to work, not everybody has reported back to work because we are allowing people to work from home. However, when they eventually return back to school, it will be mandatory for them to produce their COVID vaccination certificates and all the other mandatory requirements which have been stipulated by the governments. We are located in the Haryana region, so we obviously wait for an advisory from the Haryana government to take things forward and very closely follow the advisories that are issued by the governments. Children will have to be educated that using a mask and a sanitizer at all times is a must. It is a non-negotiable. So often when we talk to the children, which we are doing constantly, we are bringing this up constantly that, for example, at this point of time, we are preparing for children to write their IGCSE examination, which is grade 10 examination. All students, in fact, this morning we had a webinar where we spoke about this, that carrying a sanitizer with you and wearing your mask, maybe double mask, is absolutely a non-negotiable. And children between the ages 15 to 18 should ideally be vaccinated. They should be vaccinated to be able to come back to the school campus to write an examination, even an examination for that matter. So, of course, the schools, you're aware that schools are running free vaccination camps all over. So, including ours, I think all schools, we were one of the first few schools to have started a free vaccination camp for our own children and also children in the vicinity. So I think all schools will have to take these measures to be in a state of preparedness, to bring children back so that no one is at risk, or if at all there is any risk, that is minimized. And immediate, action is taken and a very, very vigilant overview of the situation so that the moment you find somebody reflecting symptoms, immediately medical help is available. I think that is another very significant thing, that medical help should be available at all points of time in all schools to assist children and the staff who are reporting back to work. I hope that kind of answers your question.
Definitely, ma'am. I think my school has also put in place a lot of the measures that you just mentioned. Masks and sanitizers, I think every student is supposed to carry at all times. We also had temperature checks before boarding the bus and entering the school premises. And now that you did bring up that students from age 15 to 18 also should have the vaccine, post this third wave reopening, we are being asked to produce vaccination certificates to the schools. However, there is a slight debate as to whether just a vaccination certificate is enough, or should schools also be asking for RT-PCRs, because some people with vaccinations are also getting the COVID virus. So if you could just shed some light on this.
Sanika, most definitely. I think you have a point there. People who have been vaccinated and double vaccinated also, including adults, are being affected by the Omicron wave particularly. It may be mild, but definitely a lot of people have been affected and families have been affected. I'm not talking about individuals. Families have been affected because one person gets infected in the family, I think invariably everybody else gets it. So yes, we have told the children that in case you're not vaccinated, there are some children who may have gotten the first vaccine and not taken their second vaccine. So however, we are telling them that you should bring your RT-PCR report when you return to school, but not all. If the vaccination certificate is in place, in fact, I would like to ask Dr. Kapoor, perhaps he can shed better light on this than I can. And this is a question I'd like to pose to Dr. Kapoor. Perhaps he can enlighten us on this, that in case if if the children are able to produce a vaccination certificate, should it be mandated also that the RT-PCR report be brought in as well?
Uh, Dr. Neeta, is a very important questions you have raised. But let me again bring to the focus the point that at this moment, if you go by statistics, by the evidence which has been generated, the 65% of students, as per the zero surveillance data available with us, they've already been infected. 65%. Sitting at home. Point I'm making is sitting at home. So is home a safe place if 65% infected? So let's come out of that domain. This home is safe. Sitting at home, they've got infection. Second thing, even if they've got infection, most of them were asymptomatic. They didn't know about it. Zero surveillance was done and they were asymptomatic. Nothing happened to them. Less than 2% who got infected needed some care, and less than 1%, other 0.8% needed ICU care. Less than 1%. 0.8% to be precise. I have my presentation ready for this. If you want me to make a PPT, I can make a small presentation also. I made it for this particular thing. Shall I have this presentation for 5 minutes? Do you like to hear it?
Yes,
That
definitely.
would be
Sir.
great, sir.
Sure.
Yes.
Okay. Please enable it. The sheet sharing has been disabled by you people.
Yeah, sure, sir. Rupal, can you please look into it?
Is saying hosted disabled it.
Yes, sir. Just give us a second. We are doing it.
Dr. Kapoor, you should be able to do it now.
Okay. Yeah. Can you see my screen now?
Not yet, sir. Not yet.
Aghosh? भेजना आगोश को. Screen sharing. Yeah. Is it visible? देखा screen share करनी है.
No, sir. Not yet.
इस पे.
Sir, Swadesh, sir, would you like?
1 minute.
No problem, sir. Till you share the screen. So I'm just asking Swadesh, sir, if he would like to add something on it. Okay, so we can see your screen right now. All right.
Okay. So we very first I say we borrow this bar from children and we owe it to them. Their health, their social health, their mental health, their emotional health, their education, everything we owe it to them, isn't it? And look at this. The World Bank's Global Education Director is saying this, that there's no evidence that reopening school has caused a surge in the coronavirus cases in the schools. And come out of this, that it's a safe place. It doesn't make sense at all to close the schools at the moment and wait till children get vaccinated. So I've come to that point also, that we are asking for the certificate for vaccination. No, even that is not required. Even Supreme Court has made this observation, we can't ask for a certificate of vaccination. And other thing which is very importantly saying is that impact is not that severe as was previously thought, particularly in Omicron, which is such a silent virus. It's just like a flu virus. I'll say, I'm a pediatrician. I'm seeing most of the cases who just coming with fever and cough and cold for 3 days. And after 4th days, most of them are okay. So they're saying typically, please go ahead and open the school, which is very important. And open the school. That's very important, which is you have to really talk about this. So we have to talk about health to well-being, from learning to experiencing. Children are missing the experiencing part of it. We've just been going online and giving them lectures, but the experience of asking the questions, of interacting with each other, the peer learning is the key thing to learning which students have been missing. From answering to questions, from observing to participation. I was a science student. I really can't think, how can we teach science without hands-on thing? This is such a thing which is, I was very feeling about this. But what are the challenges? We have really marginalized our students. Their normal activities, routines have been disrupted, health risk and malnourishment. I'm very concerned. The students in the government schools, they used to get midday meals. which they're not getting now. It's just not academics. Just think about them issues of lowering the immunity. By making them malnourished, we are making them more vulnerable to COVID, I will say, to other diseases, because they're going into malnourishment. Vitamin D deficiency, sitting at home, most of my children are seeing are vitamin D deficient. And vitamin D deficiency vitamin D gives you immunity to fight diseases. And look at this, we are not providing to them. Social developmental issues, strong negative emotions, stress arousal symptoms. छोटी बातों पे they start fighting now with the moment. They're so irritable at this moment. If you don't give them small things, parents say, they get angry, they get clingy, anxious, withdrawing, angry, agitated. All these issues, we have to talk about this. And at the same time, the screen addiction happening, computer eye syndrome, dry eyes, poor self-esteem because of obesity is another spectrum. One side is malnourishment, other side is obesity. Exposure to unwanted social media, online games. Most of the times, they'll keep on opening 3-4 windows together. Moment parents come, they will show the screen of the school. And moment parents go out of the school, out of the room, they will open the games part of it. And you believe this, they're very smart. We can't take them this. They're not smart. They're very smart people. What are they doing is very difficult to change. Then financial issues, substance abuse has increased, alcoholism, substance abuse has increased. And for the females, I say we used to distribute sanitary pads also for the students. They're not getting at the moment. Such a important life-saving thing, again, I will say, iron, folic acid, then sexual coercion and abuse happening, child labor, early marriages, reports have come in, early marriages, child marriages happening. So there are so many drawbacks of keeping them away, killer diseases which are there. The future of them is in dark. Literally, we have to think about all these issues. The internet, look at the abuse offenders are over there. They're getting bullied on internet also. If you don't do this, we will do that to you. Abuse of children, all these things are happening. And academic losses definitely is main responsibility of the school, which you have to take orders. And primary classes. I have a Nati, I'm a Nanu. She was lucky to go to school for at least 6 months, but there are so many 6 years old who have not visited schools even once. What a school looks like, how is the teacher talks to them. They have not started going to the schools. Then even if you say hybrid mode, even 80% have something, 25% of them still don't have the equipments at home. How are they going to connect with us? They lost language abilities, mathematical abilities they've lost. So academic of the country is going to go very down, and that brings down the poverty also. If the academics are not there, the country is going to get poor. That is what I believe also. Very important things. And school is just not IQ. That's a very important slide. It's EQ, it's SQ. Life skills are being learnt over there in schools. And this concept has now been taken off, but this is a very important concept. Continuous and comprehensive evaluation. Online, you can't do this continuous evaluation. You can do once in a while evaluation of the students, and that too is not to the best possible things. So all these things which I will say is very important. So I will stop over here. There are many slides which I can depict over there. There's so much data in favor of opening, but please don't ask for the vaccination certificate. Was the disease is so mild? I've already said 67% are already been infected. And if they're not infected, the disease is going to be very mild. And if we keep them home, the effects are far more worse than this. Yeah? Risks are so low and costs are so high for them. Yeah? Look at this. So why are we not opening? Why to ask for a vaccination certificate? I'm saying that children who are younger, they're least affected. The infection is so mild in them. So we should open the primary schools also. I'm hearing nowadays, most of the cities are opening, states are opening schools for the middle school or secondary schools. But look at the primary schools, which are literally not get affected much of it. Primary school, we should open all the schools, all classes together. This is the data which I was quoting. 0.8% required ICU admissions, 0.8%. 2.5% required hospitalization. That too, they come out of hospital after 2-3 days. So where is the time to worry at the moment is let's open this, and surveys which have been done there, all parents are saying now, you must have gone through this surveys, 70 to 80% of parents are coming to us. Yes, please open. Even teachers are now saying this. please, we are gone into fatigue. We are not able to go on like this. Please call the students back to us. Students fatigue is also there, and all of them are asking for this. But definitely, let's talk about other things which school has to be prepared for. At this moment, I will say no vaccination certificate to be asked for them. Let's open the school and take care of them. Thank you very much.
Thank you, sir. Very much needed. And I mean, the way you have explained, thank you so much. So Swadesh, sir, what are your views on this? Like, would you like to add something to it?
Yeah, by heart, sorry, by heart, like everyone, I also want our kids will go to school, healthy nation, learned citizens. That should be very good. Okay. 24 months has been passed. Government and medical fraternities day and night working, and then created every day the record that they are vaccinated. I'm saying just wait for some time so that our kids, I am vaccinated, after that I come outside. I'm saying when I enter somebody, I belong to industrial setup. In industry, it is a mandatory. If you show the vaccine certificate, then you can enter in the premises. Otherwise, industry will not allow. Industry allow, then administration will not allow.
Sir, please don't compare yourself. Dr. Swadesh, you were there in the last seminar also with Dr. I heard it completely on that seminar also. But believe me, I will say, rather than vaccinating children, the adults in the family where students are staying, the older people, they should get vaccinated. Because even after getting vaccinated, you get infection. Even if children get vaccinated, they will still get infected. Isn't it? And infection, they will carry home. They won't get any symptoms. 80% will be asymptomatic, but will they carry the infection home? So let us make this movement that students, parents, students, grandparents, all elders in the family should get vaccinated, rather than focusing on students should get and asking for their certificate. That's not required.
Certificate asking is not saying. Just give me 2 minutes, Dr. Kapoor. I respect your whatever your concern. I, as a parent, I am also a parent. So I want my child, and my child has attended luckily 3-4 months in a school. Then suddenly I remember that when she started sneezing, what happened to me and my wife? Frankly speaking, that was a normal cold in the month of around 25th or 24th December. This is a personal matter. I'm not saying what happened to us as a, and all over my near and dears. I think on a particular day, more than 300 call I have received. That's how is the thing? How is the thing? That's the children's. We owe the children. You say that absolutely. Children's makes the nation. We are now going to hand over the nation to the children. Okay, down the line, 5 years, 10 years, they are going to respect inclusiveness. As a CSR professional, we always believe that inclusiveness is a very costly thing for today, but it is very beneficial. Return on investment will be very high on inclusiveness. When we exclude, currently I say vaccine movement is one of the possible solution for this. Number one. Number two, whatever, I am not a medical expert, but whatever the government has told us in the letter and spirit, we know that social distancing, Holy Bible for this. Okay, हमारी गीता में social distancing, masking, absolutely. हाथ धोते रहिए, याद है हम बराबर धो रहे हैं, सही ना? अब just imagine, India, you are saying that हम बच्चों को मिड डे मील नहीं दे पा रहे हैं, जस्ट सही है, तो हाउ द वी कैन प्रोवाइड द सैनिटाइजर टू द चिल्ड्रन. ओके, नंबर वन. मिड डे मील का जो आपने बोला थोड़ी सूचना गलत है. मिड डे मील का मनी उनके अकाउंट्स में ट्रांसफर हुआ. मिड डे मील का मनी गवर्नमेंट ने उनके अकाउंट में ट्रांसफर किया, सबके में डायरेक्ट बेनिफिट ट्रांसफर.
इवन फ्री राशन was provided.
वो malnourished का उससे प्रॉब्लम नहीं है.
But still, did they get the meal? Their parents were losing jobs. So that money was not used for the right purpose.
Sir, let me. School, you say that when we open the school, world will become very good. Crime against the children all children will become healthy. Societies will become 21st century.
So what is the point against?
Child will become healthy. I think 20. जब ये होगा तो 22 का हमारा मार्च चल रहा है. मतलब जनवरी चल रहा है. मार्च तक होपफुली हम लोग पॉपुलेशन को कवर, एक दिन में हम लोग 1-1 करोड़ वैक्सीन कर रहे हैं. की है
सर, वैक्सीनेशन से without vaccination also children are asymptomatic. I'm saying
Absolutely.
70% are asymptomatic.
ठीक है,
They are getting very mild disease.
एब्सोल्युटली डॉक्टर साहब, दो चीजें हैं. एज ए गार्जियन नेशन जब रन होता है, रेशनल अप्रोच पे भी चलता है, इमोशनल पे. बुलेट प्रूफ जैकेट 100% बुलेट प्रूफ नहीं रोकती है, लेकिन हम सोल्जर्स को बिना बुलेट प्रूफ जैकेट के भेज देंगे तो गवर्नमेंट को जवाब देगा.
लेट मी कंप्लीट. इन्फ्लुएंजा जैसी इलनेस हो रही है और इन्फ्लुएंजा का इंजेक्शन लास्ट 10 ईयर से अवेलेबल है. इलनेस जो कोविड से हो रही है, ओमिक्रॉन से हो रही है, जस्ट सिमिलर टू इन्फ्लुएंजा, इवन लाइटर देन दिस, 3 days फीवर एंड कफ एंड कोल्ड. एंड इन्फ्लुएंजा जैसे इलनेस और इन्फ्लुएंजा का इंजेक्शन 10 साल से अवेलेबल है. कभी किसी ने डिमांड नहीं करी इन्फ्लुएंजा का लगवा के लाइए इंजेक्शन. सेम बीमारी, सेम इलनेस, सब कुछ सेम. इन्फ्लुएंजा में भी तो एडमिशंस होते हैं, निमोनिया होता है, उसमें भी होता है. 10 साल से इंजेक्शन अवेलेबल है सब मार्केट में. किसी ने नहीं कहा इट इज ऑप्शनल, इंजेक्शन लगवाइए तो लगवाइए, वैक्सीनेशन से क्या होगा. एंड बिलीव मी, अभी भी 30% जो लोग दाखिल हो रहे हैं, अडल्ट्स की बात कर रहा हूं, दे आर वैक्सीनेटेड. 70% ऑफ देम आर नॉन वैक्सीनेटेड हु आर गेटिंग एडमिटेड इन द हॉस्पिटल्स, but 30% are having one vaccination dose. So what is the fun of having a vaccination? किया एक डोज लगवा के बच्चों को बुला रहे हैं आप, और 30% चांस अडल्ट्स में अभी भी है और बच्चों में है ही नहीं. बच्चों में विदाउट वैक्सीनेशन 0.8% एडमिशन, 0.8% सर, जो किसी और इलनेस से भी हो सकता है. सो अगर फ्लू जैसी इलनेस है और उसका इंजेक्शन अवेलेबल है, हम उसकी तो बात कभी नहीं करते हैं लेकर. So please come out of that mold. Requesting you with handhold, please, parents का fear को निकालिए. We are the ones who have created this fear in the mind of the parents, in the mind of the teachers, that this can happen. Now the things have changed completely. Thank you.
2/3 India is struggling. India have a 2-3 type of. India is a very vast nation. This society we broadly divide 2 or 3 types. If we divide this society not for academic purpose, just for our discussion purpose, there are 3 types of fellows. One who strictly follows the school or government instructions, able to follow everything. अभी डॉक्टर साहब ने जो एक फोटो दिखाई थी, does that photo follow the social distancing? यूनिसेफ के आपने कोटेशन में, अगर आज उस तरह से बच्चे नहीं बड़े भी आएंगे तो
मैं I'm expecting कि नहीं होगा social distancing स्कूल में. I'm saying this, but still I'm not worried because this is so mild, sir. स्कूल के टाइम में लंच जब होगा, they will remove the mask also. They will do the barting. They will share the food. That's the normal behavior. I'm telling you. But the disease is so mild, sir. Come out of that mold कि disease होने वाली है बच्चे को. I'm not expecting that to happen, sir. बच्चे बच्चे रहेंगे सर. और अभी घर में बैठ के क्या हो रहा है सर? 70% घर में बैठ के इन्फेक्ट हो रहे हैं सर.
That's why I'm saying that.
Parents are going out to clubs. They are playing in the grounds. मॉल्स खुले हुए हैं, सब कुछ खुले हुए हैं. इन्फेक्शन लेके आओ और घर में बच्चे को दो. पर स्कूल भेजते वक्त क्यों टेंशन मेरे को?
Completely agree. Education is suffering.
So it's not education, mental health, social
our
health,
future are suffering.
Everything is suffering, sir.
Most of the guys are who I think if class 2 and 3 students will not get chance opportunity to see the
Go
school.
to schools. You are right, sir.
Absolutely perfect.
I hope you will come with me today evening, not like last time, and you will say let's open the schools.
Absolutely. But I'm saying a small caveat is that as an emotional baby, when we think that
I'm not emotional.
0.8% for the as a guardian, 0.8% जिसके किस्मत में वो 0.8% आएगा गार्जियन के, वो गार्जियन हमको आपको या स्कूल को या तो इसलिए मेरा ये कहना है सर कि हम इंक्लूसिव
यही पेरेंट्स को
सॉल्यूशन निकलेंगे. साइंस हमारी इतनी एडवांस है, वी आर ए रिसोर्स कंट्री. हम कहीं स्कूल आप बोल रहे हो जो स्कूल इज नॉट ए पैनेशिया, 360 डिग्री डेवलपमेंट कर रहा है वो सही है, लेकिन अभी देयर आर 3 टाइप ऑफ सेलिंग. अगर मैं देखता हूँ वेदर खराब है, फ्लाइट रुक जाए थोड़ी देर, दिल्ली में 9 बजे नहीं 9:30 पे पहुंच जाऊंगा, सही है ना. वेदर खराब है, मैं रिजिडनेस में उस समय चला जाऊंगा तो शायद 9 बजे की छोड़ दें आप, 8:45 में मैं डिक्लेयर कर दूंगा कभी नहीं पहुंच पाऊंगा. वी वांट टू बी लाइक दिस. जो 0.8% है सर, आप उनसे बात करें. वो 0.8% या जिन फैमिलीज की मैं बता रहा हूँ, सुप्रीम कोर्ट ने भी बोला कि इनको आप गिन नहीं पा रहे हो.
सतीश जी, वर्ल्ड कभी भी परफेक्ट नहीं होने वाला है सर.
Absolutely.
Let me tell you this, sir. Let it be air flights, let it be road accidents. World will never be perfect. Let it be America, let it be Sweden, let it be India. World will never be perfect, sir.
Absolutely. Lekin
So
we
if
should,
Omicron continues, new virus will come. That will
So,
be maybe milder.
मैं एक
Shall we
solution,
keep the
मैं,
school
हाँ,
closed
sir,
forever?
देखिए
I'm
इसमें
so
मैं
sorry
सर
for
एब्सोल्युटली
interrupting.
आई कंप्लीटली, मैंने आपसे कहा एज
Swadesh sir.
या 2 मिनट मुझे दे बस, ये शिवानी, यस, इस पे ये है, हम स्कूल खोलेंगे, खुलने चाहिए, खुल भी रहे हैं, सही है, हमसे ज्यादा टीचर्स चाहते हैं उनकी एजुकेशन को, क्योंकि टीचर्स पे लोड है एकेडमिक का, कि कल उनको पूरा सिलेबस करना, सारी चीजें, मैं हम लोग स्कूलों में रेगुलर जा रहे हैं, देख रहे हैं, मेरा ये कहना है देयर आर सर्टेन फाइंड आउट, क्या 360 डिग्री का आप डेवलपमेंट कर रहे हो, नंबर वन, हम थोड़ा सा हाइब्रिड मॉडल है, नंबर एक, रोटेशन से बच्चों को बुलाए, 2-3 डेज बुलाते हैं तो 3 डेज उनको आइसोलेशन पीरियड देते हैं, इस तरह का कुछ करके हम वर्कआउट कर ले 80%, जब हम 110% इफिशियंसी नहीं ले पा रहे हैं, 100 के नीचे आके उसको ले, ये जरूरी नहीं है सर कि स्कूल, नंबर एक, और नंबर दो, द टाइम डिजीज इज आउट ऑफ बॉक्स, तो बॉक्स सोल्यूशन नहीं आएगा, ये स्कूल जो हमारे हैं ये उस समय भी थे, 1947 में भी सिमिलर स्कूल आई हैव सीन, विजिट में अहमदाबाद में हमारे पास जो साबरमती में स्कूल है, दैट वाज 97 पे भी था, अब ग्राउंड अच्छा हुआ ऐसा हुआ, लेकिन मेथड वही है कि टीचर आता है, दुश्मन हमारा इनविजिबल है, अब याद करो, इनविजिबल दुश्मन है, स्मार्ट दुश्मन है, एनिमी इज स्मार्ट, एनिमी इज इनविजिबल एज वेल एज एडमी, आई थिंक ऑनलाइन इनविजिबल जैसा ऑनलाइन की तरह ये चल रहा है, तो हमको इसके लिए आउट ऑफ बॉक्स सॉल्यूशन सब लाने पड़े, आउट ऑफ बॉक्स समथिंग अगर करते हैं तो सॉल्यूशंस इसके आ रहे हैं, क्या हाइब्रिड मॉडल पे ले जा रहे हैं, मेंटरशिप पे ले जा रहे हैं, हम क्यों कह रहे हैं कि 40 बच्चों 30 बच्चों को बैठ के हम टीचर करा रहे हैं, 5 मेंटर कोच, हमारा पहले भी द्रोणाचार्य कोच कर रहे थे, उन्होंने भी वर्ल्ड लीडर प्रोड्यूस किया, वी इंडिया इज अ नेशन ऑफ डिफरेंट पॉसिबिलिटी, वी हैव टू फाइंड आउट, नंबर वन, और इंक्लूजन के लिए एब्सोल्युटली मस्ट है, वी हैव टू, नंबर 3, आप आज से 10 साल पहले देखोगे हमने हर विलेज में अब आशा वर्कर्स जैसे कर दिए, तो माय सजेशन है कि वी शुड create a different additional wing in the each school, this enemy is not going to remove in 22 or 23, या फॉर्म चेंज करे, और सर जो बोल रहे हैं एब्सोल्युटली डॉक्टर कपूर, आई एम कंप्लीटली एग्री कि आज नहीं तो कल भी कोई और नया दुश्मन आए, तो अब हेल्थ हमारे पास आ गया है, जैसे हमारे पास आया था, आपने गुड टच बैड टच सिखाया बच्चों को, हम ही ने सिखाया, आप ही सबने मिलकर हम लोगों ने सिखाया, आज बच्चे सेंसिटिव है, जब वो चीज आई, नंबर 2 कुछ आया, तो हमको एक हेल्थ, वी हैव टू क्रिएट अ हेल्थ विंग इन द स्कूल, सो दैट वन एटलीस्ट स्कूल्स में हेल्थ कोऑर्डिनेटर, किसी जो 2/3 में रूरल इंडिया की बात कर रहा हूँ या पुअर इंडिया की बात कर रहा हूँ, तो जिसपे हमारे पास हेल्थ की कोई कंसर्न, जैसे आशा वर्कर की पॉइंट की, आशा वर्कर की ड्यूटी लगाए वहां पे, या एक हेल्थ डिपार्टमेंट को वहां पे रिपोर्ट करें, जो कि स्कूल हेल्थ, क्योंकि वहां 400 बच्चे हैं, 500 बच्चे, जरा से कितने 5000 स्क्वायर फीट में, 3000 स्क्वायर फीट में, हमारे पास 400, तो एक हेल्थ का बच्चा कोई एक अपॉइंट करे, हेल्थ सेंसिटाइजेशन एज वेल एज हेल्थ चेकअप, दिस थिंग, ऑब्स्ट्रक्ट किसी को नहीं करे, इंक्लूजन अलाउ करे, इंक्लूजन होना चाहिए, लेकिन विद सर्टेन कैविएट, दैट्स माय हम्बल रिक्वेस्ट एंड सच कि हम इसको ओवरलुक नहीं, और देखिए वी हैव टू प्ले स्मार्टली बिकॉज वायरस इज स्मार्ट एनफ, नंबर 1, नंबर 2, वेरी चेंजिंग बिहेवियर, अभी मैं मतलब यू नो मच बेटर देन मी इन अबाउट द मेडिकल, कोई कल परसों आया था एन कोवियो करके, कोई और वायरस मच, तो डेली कुछ ना कुछ आ रहा है, अगर हम आज फिर स्कूल हैजार्ड वे में खोल देंगे, कल फिर हम 3 महीने हमने खोला था फिर बंद किया फटाफट, तो जो हमने प्रॉफिट नहीं किया था उससे ज्यादा हम नुकसान कर गए, बच्चों का एक बिहेवियर हुआ पूरी, और सब बच्चे इस समय सब मेंटली डरे हुए, फ्रैंकली स्पीकिंग हर बच्चे का साइकोलॉजिकली प्रेशर, गार्जियन डरे,
सर प्लीज डोंट क्रिएट फियर, जो आप बात कर रहे हैं नियोकॉफ की, वो अभी बैट्स में है, ह्यूमन में नहीं आया सर, प्लीज फॉर दिस सेक, इस प्लेटफॉर्म पे लेट्स रिमूव द फियर्स ऑफ द पेरेंट्स,
एब्सोल्युटली,
आप ये मत कर, we are really here to remove the fears and go for the things that we should open the schools. My humble request.
Hey, school should be open. School, yes, I am the first person who want to be.
I wish, madam जो नीता बाली है वो बताएं how easy it is for teachers. I wish yesterday there were so many teachers for do the 2 types of session. One is online, one is offline. Both the things has to, I go with you then, let's go with you. We will leave it to the parents. We can't make anything mandatory. This is a democracy. If the parents wish to send the students to the school, let them send to a school. We are ready to receive them. If they want to keep them with themselves, let them keep themselves, and hybrid mode chalega. But ask the teachers, They're going to
Dr.
teach
Kapoor, let me answer
students.
that one for you, because I think that's a very pertinent question you've asked. And Sanika, I'm sure as a student, if you're a student of a school, you would also know. The reality is when you run the school in a hybrid mode, it is very, very taxing for the teachers, most definitely. There is a lot of exhaustion. There is a lot of, virtual exhaustion. The reason being this, simultaneously, we are asking the teachers, two sets of teachers, what we normally do is there are children who are doing online classes and then there are those who are doing offline. Now in the lower classes, because we are able to divide children, so one teacher takes online, the other takes offline. But for the senior students, because you have subject specialists, in that case, you have to take it twice over, all right? Or you have to put cameras in the classrooms and get some students are online, the others are offline. So obviously it is very taxing for teachers to cater to both sets of students and not easy at all for the children and for the teacher to focus on what is being taught in the class. It's very, very taxing. But having said that, let me also tell you that when we did reopen the schools, which we did, there are a section of parents who are very reluctant to send. I can completely understand their anxiety as an adult, as a parent, and as a teacher. There are parents who are very, very apprehensive about it and do not want to send the children. Whatever assurances you may give, they may not want to send the children to schools. And we have to understand and comprehend and empathize with them. But Dr. Saab, as you very rightly, you're giving statistics. I think that the presentation per se was very, very informative. In fact, Dr. Jaipal, I would request you, if you could share this presentation with me, I'd like to study it in detail. Because I think it has some really relevant facts that we as educators must be acquainted with, because obviously it's a very well-researched presentation. So in fact, Rupal and Shivani, I would request you, if we can have Dr. Jaipal
Sure,
send
I will send it.
If you could send it to Shivani and Rupal,
Definitely.
I'd like to have this presentation, sir, and I'd like to study it thoroughly, because I think it's a very well-researched. But it's tough to run a school in a hybrid mode. Let me tell you this, with the best of technology, it's really tough to run the school, and for children also, I'm sure.
Right, ma'am. Right, ma'am. So my next question, yes, so can I put up my question?
One thing I want to just,
Yes.
Dr. Neeta has accepted that it is tough to run the school in a hybrid. And why we are avoiding, it is a tough. Okay. Tough things. We are going to the easy path. Just open a school at the 1947 or 2000 model and fight with the disease of 2022. I am saying we should prepare for the 2024 and then open the school in 2022. Science have all the solutions, everything. Inclusion is a very costly thing, but in the long run it is going to pay you. I'm definitely saying include every children, everything. Just imagine that the one child, I have, not to mention that I have read that sometimes some parents got COVID infected, whole school and management has been issued a notice by the DEO. Why do not disclose? As the school principal was just saying, it is very sorry, parent didn't inform us. And whatever happened with the 30 to 35 children. That's just one scenario. Number two scenario, small children is sneezing in a society when he came. The husband and wife, two normal families, this is one children. All children start sneezing, whole society got to that. This is ये school जा रहा था, this is got पूरी society को बेचारे निकल. That the society is happening. I'm absolutely tough चीज है, हम avoid कर देंगे. Tough. We want to be a short game. तो 2024 का preparation करके हम 2022 में run करेंगे. हम वैक्सीन दी, nobody was saying, पूरे वर्ल्ड में हमने सबसे ज्यादा दी, prepared किया, इन्वेस्टमेंट हुआ, सब चीज हुआ. हम 2024 का प्रिपरेशन क्या होना है इस डिजीज पे, वो करके वी आर गोइंग टू ओपन द स्कूल. देन नोबडी विल से कि आपने 3 महीने खोला है. एब्सोल्युटली, मेरा मन नहीं कर रहा तो मैं आके ओपन कर दूं. दैट्स नॉट. मुझे टफ लग रहा है, मैं जाके ओपन इजी वे कर दूंगा. वी आर बाउंड विद द सोशल डेमोक्रेटिक सिस्टम. गवर्नमेंट इज अकाउंटेबल नॉट फॉर द गवर्नमेंट, इज अकाउंटेबल विद द लास्ट पर्सन ऑफ द सोसाइटी हु इज सिटिंग, who doesn't know that कि मेरा बच्चा स्कूल गया, शाम को सुरक्षित खाना खा के आएगा. उसके लिए गवर्नमेंट है. मेरे आपके लिए गवर्नमेंट है, सही है, लेकिन गवर्नमेंट का सबसे, गांधी जी के प्रिंसिपल पे हम लास्ट मैन ऑफ द सोसाइटी। तो जिसके, अब उसका इमेजिन करें, एक चाइल्ड जिसने somehow कैजुअलिटी हुई है उसकी, he has lost parents in कोविड, अब वो एजुकेशन पे जा रही है, उसकी माँ है उसको पाल रही है, सब कर रही है, छोटा मोटा खा, वो एजुकेशन लेने स्कूल जा रही है, मिड डे मील खा भी रही है, सब चीजें। अब सडनली दैट गॉट, आई एम नॉट सेइंग सीजनल फ्लू हो गया, इन्फ्लुएंजा हो गया, दैट चाइल्ड का पुअर है, एवरीबॉडी इज स्टार्ट, इज अ पेशेंट लाइक दिस, उसकी मदर को भी आउट ऑफ जॉब कर दिया फॉर 14 days, और बच्चा भी आउट ऑफ स्कूल हो गया। तो दैट सोशल स्टिग्मा, जस्ट इमेजिन ऑफ द लास्ट पर्सन ऑफ द, वो किससे का है, उसके घर खाना भी नहीं है। और ये दिस केस आप पीछे का टाइम्स ऑफ इंडिया या कोई पेपर उठा के देखे, दिस टाइप ऑफ हैपन, होल फैमिली अगर सोसाइटी के बाहर निकली है तो उनको लोगों ने परेशान किया है। अब लास्ट, तो मेरा यही कहना है, 22 में 24 का प्रिपरेशन हम कर ले, स्कूल चालू कर दे। मैं आप मुझसे बोल, आई कैन फाइट विद द सोसाइटी, आई कैन फाइट, आई गिव आर्गुमेंट, मैं आरटीपीसीआर ले आऊं, लेकिन उस लास्ट बच्चे को समझे वो कहां से आरटीपीसीआर लेके आएगा, उसकी मदर मेड थी हाउस में, डू यू अलाउ टू एंटर दैट लेडी इन योर हाउस, द सोसाइटी इज गोइंग टू अलाउ, अगर उस बच्चे को खांसी आ रही है बाहर निकलो, बस में से लोग उतार दे। तो दैट टाइप ऑफ, वी हैव टू कंसीडर द लास्ट मैन। एजुकेशन जो गवर्नमेंट का इंफ्रास्ट्रक्चर है उन बच्चों के लिए, मिड डे मील उन बच्चों के लिए जिनको घर पे, तो मिड डे मील या ये चीजें जब सोसाइटी खा नहीं पा रही है तो उनको एकेडमिक, और मेंटल ट्रॉमा इज गोइंग टू बी वेरी, आई एम नॉट अफ्रेड, आई एम जस्ट डिस्कसिंग बिकॉज आई एम थिंकिंग दिस, वी आर डिस्कसिंग, वी आर लिसनिंग विद द एजुकेटेड क्राउड, दे आर सो इग्नोर्ड। मेरे अफ्रेड कराने से कोई अफ्रेड नहीं होगा, दिस इज रैशनल, बट आई एम सेइंग यू द सिनेरियो बिकॉज एज ए सीएसआर प्रोफेशनल वी ऑलवेज ट्राई टू रीच द एंड लेडी। मैंने उसका बताया, जरा हाउसमेड है वो छींकेगी, व्हाट विल हैपन विद यू इन योर हाउस, फर्स्ट पर्सन वी विल स्टॉप द कमिंग ऑफ दैट फैमिली। सही है ना, क्यों, अब वो क्या देखेगी, उसकी बच्ची से उसको जुकाम हो गया, दैट द सोसाइटी। अभी मैं खांसने लगूं तो पीपल विल से कि सक्सेना साहब गो आउटसाइड द मीटिंग, दैट्स गोइंग टू बी हैपन। तो जस्ट इस सिनारियो पे देखिए, और स्कूल का आप, आई एम कंप्लीटली एग्री, आई एम आल्सो प्रोडक्ट ऑफ स्कूल, यू आर, एवरीबॉडी वांट टू बी स्कूल, लेकिन स्कूल को मैं कह रहा हूँ 20, हमको प्रॉपर सैनिटाइजर का कितने स्कूल आ रहे हैं, I'm not saying ड्रिंकिंग, जब हमारा स्वच्छता मिशन चला था तो लॉट ऑफ पीपल सेज कि वाटर नहीं है, इंडिया इज अ वाटर स्केयर जोन, तो आज सैनिटाइजर लाके हम 5 मिनट में हाथ धोते रहेंगे तो वाटर हमारे पास इतने स्कूलों में, जो 2/3 इंडिया है, अभी आप जस्ट इमेजिन करेंगे, तो जहाँ वाटर की, ड्रिंकिंग वाटर स्केर्सिटी है, तो वो किसी तरह से अपना इकोसिस्टम बना के अभी कर रहा है, गवर्नमेंट ट्राइंग टू रीच टू देयर, तो उनकी एजुकेशन का हाइब्रिड मॉडल चल रहा है, चलता रहे जब तक कि अब, और मेरा वैक्सीनेशन शुड नॉट बी मैंडेटरी, वो गवर्नमेंट डिसाइड करेगी या नॉट। सो मेरा कहना है कि वी शुड गिव देम अ बुलेट प्रूफ जैकेट, देन allow them to enter into the battlefield. That's my one point solution.
Right, sir. Thank you so much. I think we are going to come to the conclusion soon. But before that, we have so many live questions from our panelists. So I would like to request for our panelists, and I would like to request Nikunj Goyal. I'm so sorry. To please introduce yourself.
Good
Hello.
evening, everyone. I am Nikunj Goyal and I am pursuing BBA from Asian School of Business, Noida.
Yeah, you can ask your question.
Due to COVID-19, school and colleges are getting shut, but we are seeing that parents and their students are traveling here and there in malls and etc. Why only this is affecting the education? So schools and colleges should be open. Also in online exams, there is no means because students copy from the web.
Nikunj, do you have any question, or you're just giving
Yes,
your inputs?
Yes, I have question like what the education sector and the specialist have planned to take the education further in this difficult time.
Neeta ma'am, would you like to take up this question?
Yes. Nikunj, thank you for asking this question. I am only going to re-emphasize what I had said, that we need to be in a state of preparedness. I completely agree with you when we say online exams. In fact, they're quite meaningless because with ready access to information on the net, And Sanika is smiling away because she knows exactly what I'm talking about. So a lot of students are resorting to unfair means. In spite of her trying very hard, a lot of students resort to unfair means to be able to clear their examinations. So the whole concept of assessment becomes meaningless. Having said that, but of course, education somehow, in spite of such dire circumstances, has continued uninterrupted. And I want to put on record my sincere appreciation for teachers and their resilience. The sheer resilience teachers have shown in the face of this very alarming situation. Having said that, we have to be in a state of preparedness. As I said, as educational institutions, whatever mandate the governments or state governments are giving the institutions, we have to very closely follow those mandates with regard to sanitation, with regard to protective measures for students, with regard to vaccination drives, anything else that, and with regard to social distancing, because once you have taken care of whatever best you can take care of, then we are in a state of preparedness. However, I think in spite of the assurance that Dr. Jayapal is giving us and with very well-researched facts, there is this fear psychosis that everybody is suffering from. And I think more significant than the real problem itself, we have to get rid of this fear psychosis, because I really think that the moment somebody gets symptoms, cold-like symptoms or influenza-like symptoms, we presume that we have COVID. We presume, and it's psychosomatic. The illness that also follows, I think the aggravation that follows, or the aggravation of the symptoms that follows, is also psychosomatic. So, Nikunj, I think all institutions have the responsibility of going by the mandates of the medics and the state governments in ensuring that we are in a state of readiness to welcome you all back on the school campus. Right?
Right, ma'am. Thank you so much, Nikunj. I hope your question is answered. So, ma'am, I think we can't agree more that the growth in personality can only be seen when we attend school physically, right? But from a parent's point of view, like, how can we manage life and growth? How can we balance between these two things? Plus, a teacher get infected. What about the teachers? Like, if he or she get infected, how will students attend the class? I mean, even after vaccination, people are getting infected.
That's what I said, Shivani, when we started talking. I did mention that when teachers come in, even though whatever the governments may say, we definitely have to ensure children are safe. All our teachers, in fact, have to be vaccinated. So they will be producing, when we go into, the other day I was going into the great, Cyber Hub, and I was not carrying my vaccination certificate. But of course, you have apps like Arogya Setu. Immediately, you're able to show the status of your vaccination. So it is very important that every teacher who comes back to work, for her own sake and for the sake of the children for whom she is responsible or he is responsible, is properly vaccinated.
Shivani, again, please. Teachers can manage with the mask on. Even if they can get infected, vaccination is definitely, you already yourself said.
But Dr. Sir, we have to take whatever measures best possible. No.
Even after vaccination, you get infection. But mask will always be there. I can't
we can't possibly say, no, we can't possibly say don't come back without being vaccinated. I don't accept that. I will not just come back without vaccination.
Dr. Nita, I'm not saying this. I'm not saying this. I'm saying all adults has to be vaccinated.
Yes.
Including all teachers, all adults in the family.
Everybody.
That's a must. But I'm not sure for the students. For students, I'm not saying this. But I'm saying for mask. All teachers can be ensured to carry the mask on their faces. So if the teachers get infected, as question of Shivani was, what will happen? Teacher will definitely be wearing a mask here to prevent that infection.
Everybody will be wearing, sir. You can't possibly enter the organization. I mean, can you walk into even a mall? Can you walk into any place without wearing a mask? You can't do that anymore.
So that's the prevention part of teachers. How do we manage
Prevention
teachers?
is also, mask is a non-negotiable. But of course, so is the vaccination. No, you can't ask a teacher, you can't tell a teacher, I mean, that you can walk in without having, without producing
Nobody is saying that.
vaccination.
They will be
Yeah.
ensured that teachers have to wear a mask.
But sir, in some, I'm so sorry, Sanika, but what we have seen on field, there are teachers. I mean, I won't point out any school, particular school, but there are teachers who are not wearing masks, like we have seen on field. Like if we think practically, तो teachers हैं काफी जो mask नहीं पहनती हैं. So what about those teachers?
Madam,
Yeah, I would just also like to add there that enforcing rules is also slightly difficult. I feel in the older age group, high school or even sixth grade
Right.
onwards, people are adhering to the rules very well. But in lower grades, I think my school had opened for primary as well earlier. And in that grades, it gets a little difficult to control children's habits, right? Because putting like touching toys all around and then rubbing their eyes or whatever, those are natural instincts that they have as younger kids. So it gets a little hard to manage those technicalities. What would you say about that? Higher grades definitely are opening, but for primary school, how can we make those precautions even more stringent and make sure that the younger kids are also taken care of?
Sanika, I'm again saying this. It's all responsible behavior. Right from HIV/AIDS days, as director, I've been talking about for adults, is responsible behavior. Some people don't indulge in responsible behavior. Let it be a mask or let it be anything else. I won't name that. Mask is also that thing only. It's a physical barrier, isn't it? But for smaller children, you are saying, I'm totally agreeing with you. You can't ensure that they will wear mask. And even WHO says less than 5 years, we shouldn't tell them to wear the mask. That's a WHO statement. We shouldn't let them wear the mask. And even other than more than 5 years, they may remove the mask when they're eating. Yeah. But I'm very safe saying this. Younger children, they don't get sick. They get very mild infection. I'm being a doctor telling you, there's such a mild infections. Even asymptomatic 70%, they're passing away within no symptoms at all. So flu is happening, so many other diseases are happening. Why are we creating such a hoopah about this COVID for the younger children at this moment? When this Omicron is such a mild disease.
Right.
Children are suffering. Just think, I was listening to Savdeshi. He was talking about 1%, one child only. I'm talking of 99% of children. He was worried कि one children को कुछ हो जाएगा तो क्या कहेंगे? I'm saying 99% children are suffering at this moment because of mental health issues. Savdeshi, please think of those 99% also. Don't think about the 1% only. Those 99% was suffering mentally, suffering psychologically, suffering physically, suffering emotionally, suffering socially, which is far more worse than the illness which COVID is going to give to them. Please think about them.
And that's a determination, is a strength for our nation. That's the doctors of whatever the
Yes, I
determination.
want the sense of you to come, sir. My sense will come from you, sir. Please give the sense to the children, to the parents, sir. They are looking towards you, sir.
Yeah, absolutely. We are in a favor of that. We should start schooling.
Say with emotions, yes, school should open. Now I want to listen to from you, sir.
Sir, school should open and school has to
Thank
open.
you, sir. Thank you
School
very
has
much.
to open. School has to
Thank
open.
you, sir.
And the teachers are working just like they are also corona warriors. At that
Sir,
time,
definitely. Salam to
definitely,
them.
they are more concerned about
coronavirus.
it. Absolutely. Sure. I completely agree with Dr. Jaipal that the school has to open. Otherwise, society is suffering very. 24-month blot is gap, and this day by day incremental gap is going on. Not 26 months is going to be multiplied that. Everybody is suffering like that. This way, mental trauma children are suffering. I'm completely agree with that. We has to open the school and find out the way how we can secure that. And responsible behavior, that's all our responsibility. We should ensure that's even ऑटो ड्राइवर भी हमको दिख जाए भाई आप मास्क लगाओ तब बच्चों को बैठा. दैट्स द हमको सोशल बिहेवियर्स का. दैट्स कंप्लीटली एग्री.
Right, sir. So, ma'am, I have a next question from you. That you said like teachers won't be allowed or they have to wear mask all the time. Totally agree, ma'am. What if a teacher get infected? So, are we prepared? Because if a teacher get infected, she will be on leave for like 10 days, 15 days. So, are we prepared? कि next teacher जो है, we have that much of teachers अपने students के लिए, अपनी classes के लिए, कि हम फिर इसको कंटिन्यू कर पाएंगे? Like, are we prepared for that?
Always, always. In fact, there is an exigency plan.
Right.
Always, because we can't take chances with, with online education, because if that is going to be your only way of educating children, particularly the senior classes, there is always an exigency plan, and there is, and we always keep a parallel teacher, parallel in the sense that, you know, two teachers teaching the same subject. So invariably, if such a situation arises, the second teacher pitches in for the duration to try and assist. So I think, in fact, that is one thing that this pandemic has really brought out, our ability to empathize with other people and to reach out. Because everyone knows that, you know, you can understand completely the predicament of somebody who's suddenly come down with, you know, COVID-like symptoms. So everybody wants to reach out. So there's always an exigency plan, always.
Right. So Sanika, would you like to continue?
Yeah, I think we have another very good question from one of our attendees. Mr. Uday, if you could unmute and ask your question, introduce yourself and ask your question.
Sanika, you can take up the question.
All right. So his question reads, COVID-19 has impacted the spread in all our lives. The underprivileged people residing in rural areas and tribal areas are mostly affected as well. Marginalized children are not only taken aloof from their schools, but also from midday meal facilities. It's privileged for students residing in the cities as they have gadgets and other facilities. But what about the children who don't have these facilities? Kindly make us aware of what steps the government has taken to ensure that the situation of marginalized children can be improved, and what are the things that we can do. So if any of our panelists could take this up.
Taninka, I'd be happy to take it up, though I'm not sure how well I can answer that, but nevertheless, I think whatever Uday has spoken about is absolutely the stark truth. You and I both know that you may be going to a very good school. I had a good school, and all our children have their own gadgets and devices. And it's very easy, you know, one home will have 4 and 5 devices. But there are these marginalized sections where children do not have access to devices for online education. One, let me say that these children are definitely being deprived, because when we look around and we speak, and when we reach out also in society, we know that a lot of children who belong to this marginalized, so to say, section, they are being deprived of education, and there are huge gaps in their education, huge gaps. 2, let me tell you that even though they may not have so many devices, what is amazing is that, for example, if there is, you know, establishment staff, I find it absolutely brilliant that their children, in fact, the parent will not carry the phone to work, will leave it behind so that the child may be able to use the phone for online classes. I mean, imagine the aspirational, you know, the aspirational side of it, that the parent will leave the phone behind so that the child is able to have access to at least some few hours of online classes, however good or bad the classes may be, but has access to these classes, which is amazing. But I still feel that the government has to do a lot more to help the marginalized section. We are lucky and we are privileged, but definitely not too many people are privileged. So governments have to do what they have to do, because I think now online hybrid model is here and here to stay. Technology, the integration of technology for education and in education, is here to stay, and we are at a point of no return. Even if, you know, the pandemic and variants are eliminated completely at some point of time, I don't see any of us going back to a simple chalk and talk method at all. Okay? Because we have also realized that online teaching learning can be a very effective option also, you know, when in a hybrid mode, or not hybrid, I would say, I know, when in a blended mode. In a blended mode, the blended mode is there to stay, because I don't foresee anyone going back to only studying in the 4 walls of a classroom anymore. But governments have to do what they have to do. I don't think enough is happening on that front.
Sanika, in Haryana, people have done it. They have created certain coordinators, health and education coordinators, and they were made to go to the field and take at least thrice a week classes of 10 to 15 students for 90 minutes at least. So that one intervention which I remember, which was done by one of the governments. But definitely the connectivity issues need to be resolved. The devices need to be given. But look at this. Even if they provide them this guidance with these devices, will be really able to manage these devices? With these people who are talking about poverty people, people living in slums, people living in tribal areas, who's going to teach them how to manage them? That's a Herculean task. Connectivity may be there, even device is there, but I don't know how to really run it, how to close it, there's so many things need to be done before you really go to them. And yesterday's seminar, the same topic, there was a mother of a disabled child and she was literally crying. There's so many services the disabled child used to get in the school. The medical checkup, many other things we used to get up in the schools. Everything is lost now. Inclusive education, Savdeshji was talking about. I know people who are child who are autistic. There were inclusive education happening in the schools. And they were growing up somehow. But now at the moment, all the growth has stopped up completely. They are really caged in their houses. And I'm really, being a child, concerned about them. I really want schools to reopen as early as possible.
In addition to that, schools were closed, but education or teaching was not closed. In almost all the states, you find out very fantastic stories. Recently, a teacher is going to the streets, contacting the out of way, personally they are contacting. The similar way, there are 2-3 channels from ISRO, government had hired, and then continuous class-wise sessions was running on that the free of cost. In Gujarat, I know that there are 3-4 channels, their education was going on. The teaching was not closed. No, I think initial period of 2-3 months, after that the schools were closed, but teaching started in different innovative way. And the teachers also come out of way. I think none of the teacher किसी ना किसी वे से innovative वे से every teachers ने इसमें contribute किया है. बच्चे कहीं ना कहीं पढ़े, लेकिन वो हमारा पुराना चीज जो old way था, that's 4 walls and the personal connect was not happening, but the innovations are continuously going on. You see that there are a number of free platforms are also started, that they are going to be number 2. Many CSR companies come, they contributed either way the handsets, either way the either mobile charging, and this way the education was continue anyhow. But school were closed.
Teaching continued. I totally agree with you, but learning didn't continue that much. So.
School plays a significant role, 360 degree. I completely agree that
the data says language ability is going down. At least one language they've lost. 70 to 80% lose their mathematical abilities and many other academic activities, scientific. Even I say medical language, medical sciences, without examining a patient, medical learning, a medical student, how can you make a diagnosis? How can you learn to make a diagnosis? So teaching has continued, but learning has not continued. There is a difference.
Yes. There is no replacement for it as school. Schools are must. We know that in the business school, what we learn, we cannot run with them.
And hands-on, sir. Yeah, it has to be hands-on, sir. One-to-one we connect with the teacher. I still remember my teacher, जो हमारी आंखों में देख के बात करते थे, sir, and I really got used to impress. Education is also an emotional issues. जो subject मुझे अच्छा लगता है, because I'm emotionally involved with this. Teacher मेरे को emotionally involved कराता है उसके अंदर.
There is no replacement. Yes.
If teaching is good, I get connected with him. But that is very difficult to happen online, sir.
Absolutely, complete. Online was I think it was a substitute only. It was trying to fill that vacuum.
It's an addition, as Dr. Nita was saying. It could be addition. Edutech is an addition to it, but it's not a replacement to it.
Absolutely, complete.
Yeah, definitely. I think what Nita ma'am said about the blended model continuing is definitely, I feel, very true, because even outside of just school hours, it's optimization in the sense I take extra tuition classes from the convenience of my home, right? Instead of having to travel a certain distance. And in that way, it has really optimized education. But I think also, as Dr. Kapoor mentioned, all the extra benefits that people used to get outside of just the academics, going to school physically, are kind of being lost in the online mode. And that's definitely why the transition back is very important.
Right. Thank you, Sonika, for giving your input as well, because it's so necessary for the students to speak up about this as well. Nikunj, you have more questions, right? So would you like to ask your question? Nikunj Goyal? Nikunj, can you hear me? Okay. Okay, so I'll take up the next question. Okay, ma'am, my next question is to you that what is that one thing that we want to happen on the first day of school? Like, what are we expecting?
On the first day of school, when we resume school, I think what we really need to do is to welcome the children back. Believe you me, the last time when we opened the school, when we reopened the school, so to say, the youngest lot were the most enthusiastic, and the largest number of students turned up in the primary classes, which was so interesting. I think the parents had probably gotten sick of having them around and were happy to send them. So it was really like homecoming. It was a celebration. So first, I think children need to feel wanted, welcomed. So that's the first thing we need to do, that when children come back, we welcome them with a lot of fervor and a lot of enthusiasm. That's the first thing. Also, I think with the older children, we need to empower the older children to go into, because I think younger children need, they learn very well from their peers. Slightly older children should be empowered to go and speak to everyone, to explain to them in a playway method that these are the things you need to take care of so that everyone is safe. Teachers need to speak about it. So safety first. So teachers need to, without causing any panic or without creating any fear, psychosis, we need to tell the children, teachers need to tell the children about the precautions that they need to take in all seriousness, so that everyone is safe and sound and they can continue to enjoy the beauty of human interaction in a good running school, which they have missed, which is a really sad state of affairs, as Dr. Kapoor had said, that, the fallout, the psychological fallout of this entire being away from school has been so tremendous. The other day, I was speaking to a parent of a grown-up kid in grade 12, and the parent was sharing with me, that there is this aggravated social anxiety, which is now starting to surface. That, because the students have been confined, particularly the older ones have been confined to their rooms using their gadgets and their, what shall I say, their techno toys. So they have now probably are losing the knack of really connecting in real life with other people. So a lot of children are going through this social anxiety, depression, and which only comes, which can only be alleviated when you come into contact with people one-on-one. So I really think that, well, it is very important that schools reopen quickly. But first, let's welcome our children. Two, let's make them aware that these are the precautions which have to be taken and are non-negotiable, so that you can continue to enjoy school, henceforth.
Definitely, ma'am. I have a slight follow-up there. Like you mentioned, some people are feeling a little social anxiety coming back. I think even when school reopened, within school, you could see people on opposite ends of the spectrum, right? People who were constantly sanitizing and changing their mask through the day, and then other people who were bindas and kind of like relaxing on the rules as well. How do we make the process of rehabilitation back into schools slightly more smoother for the students who are apprehensive? And maybe even the teachers who are apprehensive because they have families as well.
Yeah, Sanika, as I just said, we have to continue to talk before people come back to school. I think we have to continue to talk to people online. one-on-one. Talk with teachers, first with teachers to help them understand. As Dr. Kapoor said, don't be anxious. If you take these precautions, there is no need for anxiety. So first, I think before they come back, we will have to go through, at least I think I'm going to do that. We'll have a whole set of interactions. Every morning we have interactions and we have meet the principal sessions. So we'll continue to talk with children. We'll continue to talk with teachers. First, we need to empower our teachers, and in turn, then it'll percolate to children. And then we talk to parents and children. So I think the message will then, the message will go out like a ripple, right? And of course, once children come back, before they come back, we have to ensure that essential agreements, like essential agreements pasted everywhere, that these have to be adhered to. These are essential agreements if we want everyone safe. So put them everywhere for everyone to see and to read and to see and adhere to. And I think most schools are able to manage quite well, when these measures are taken. But you're right that you have people at two ends of the spectrum. You have those who are over anxious and perpetually sanitizing, and then those who are so euphoric that they completely forget about about the safety factor. So those have to be definitely, when I say take care of those, I say we'll have to take care of those because they're happy to come back, but they need to understand that it's like tightrope walking. So you keep your balance, you can walk it. You can't, you trip and fall, right?
Anika, can I add to it? The
Definitely.
schools and home are two environments which are in continuity. You can't separate them. School is definitely molding the behavior of part of it, but it's ultimately the home which builds up the behavior. So I really feel that first of all, through whichever media mode, we should talk to the parents and teachers. At the moment, same time, I'm still feeling the anxiety of much more in parents and teachers rather than in my students. They're all ready to come to the schools. They're all ready to take up their activities. My parents and my teachers are scared. What's going to happen? What's going to happen? So let's have sessions exclusively. I will request Dr. Neeta Bali to have sessions with the parents first of all. Remove their anxieties. Tell them the protocols to be followed at home as well as in the schools. Look, routines are made in the homes and they're continued in the schools.
Absolutely.
At this moment, routines are totally disrupted. This virus is called disruption of the lives.
Yes.
Have you heard of this disruption? So routines people have been taking classes sitting in the beds. So it's going to be very difficult for the students to come to schools even. So we have to build up their routines, talk to the parents, and then parents' anxiety has to be allayed. Teachers' anxiety. Teachers are more anxious. What's going to happen? What's going to happen? Virus is going to spread. So let's remove the anxieties of these two stakeholders first of all. And I'm totally firm belief students are with us. They are ready to come. And believe me, for first 2 weeks, I will request schools, forget about academics, talk about their social health, talk about their psychological health, which has affected most of them. Give them the power of resilience. They are in such an anxiety, they've come out of such a phase, they should start feeling happy. Happiness itself gives you the immunity part of it, I'm telling you. The small illnesses, you just forget about it. Oh, nothing will happen to me if you're happy. If you are sad, if you're anxious, even one sneezing, oh, what's happening to me? So give them happiness for first 2 weeks, make the environment so happy in the schools, the students feel, yes, I have to come over there and follow a routine. And routine should follow up by the parents at the schools. So that's what my plan is. Let's make it psychologically happy state in the schools in the first 2 weeks. The students wants to come, teachers want to come, and they all feel happy. Let them play around. Academics will start after 2 weeks. Let them play, let them be comfortable with their peers. So many peers they have not met for the years here. Now 2 years have passed. Let them meet with the peers. Let them build up that connections. And then we will start with the academics. Please continue with this.
Right. So you came up with so many different and beautiful solutions. And I mean, we all can follow such protocols, such guidelines as well. Yes, Sudesh sir, you would like to add something?
Come, very good psychological happiness Dr. Kapoor has created, like, but where the silent enemy, that enemy has to play some role. So creating a happy atmosphere psychologically will not make us factually happy. Emotionally is very good. We are suffering, we are suffering. So we need to go, because everything is impacting on the ground, economically, psychologically, emotionally. For the sake of showing happiness, we should make a happy, and the atmosphere is everything. Everything is happier than psychologically. So what's the need of medical science? What's the need of
that will continue, sir. Protocols will continue, but in a state of happiness, not in a state of tension.
Yeah, absolutely.
You make more mistakes if you are in tension and you not follow protocols. If you are happy, you will follow the protocols.
Might be you have gone through that data. Happiness created a more adherence to the protocols. So, but I'm saying that just see, when the question arises that people are not able to afford the online education in most of the part of country. Okay, the similar way, the most of the part of country is not able to afford to come to the school. Just see, schools are situated 20 kilometer, 10 kilometer, just in normal cities. Okay, how they are commuting? Are they commuting in the same way? We are a nation of that. See, their midday meal when the midday meal started, enrollment boost up in the school. That's what I'm thinking. We have to be prepared. Nobody has said that हम uniform में midday meal तो दे रहे थे. Why not we should give them the mask also? स्कूल की चीज होती है, बच्चा यूनिफॉर्म की तरह लगाता है. We should give them the mask with the midday meal. We should. इलेक्शन के टाइम पे इलेक्शन कमीशन ने क्या कहा? देयर विल बी नो मीटिंग फिजिकल, देयर इज ऑनलाइन मीटिंग. Why not education department is saying that the education is important, just like the democratic structure. Election commission has said there will be no online physical meeting. Meeting has been stopped. Why? Election commission also, there is no COVID, everything is happy, people go there, do the rallies and all the things.
Sir, मैं फिर कहूंगा prevalence in children is disease in children is mild,
you
sir.
were speaking,
disease in children is mild. Don't compare them with adults, sir. Please, for the God's sake.
God sake,
don't compare
provide
with
the
adults.
mask.
Children disease is mild. Mask should be provided. Okay, I agree. But don't compare adults with children, sir. That's a wrong comparison you are doing, sir.
Absolutely. You are a pediatrician, I respect that, and that's why you know scientifically what is the, but adults, everybody is important. I am saying, just imagine 20 kilometers the student is commuting, 10 kilometers student, nobody is sitting with the vicinity of the school in majority of the India. Okay, sitting outside the जितने भी schools है 20 kilometers commuting. Why mask? मैंने simple चीज कही, आप mid day meal दे रहा, you will give. Somebody asked us कि हमारे पास ऑनलाइन क्लास नहीं थे, what the suffer. The mask, अगर स्कूल ने मास्क दिया है तो student has to put it that on their face. Number one. Number two, why not government has arranged the midday meal? So why not school is asking them to arrange the vehicle for them? State transport is there. When these are all democratic rights, we should ask, then the government will think. Na? Nobody is asking. Midday meal जब मांगा गया तो हमने दिया उसको. So we should ask कि मास्क दो आप उनको. हमने फ्री स्कूलिंग की, आरटीई लाए, आरटीई में आ जाएगा अगर हम डिमांड. नोबडी इज डिमांडेड दैट मास्क. अरे उनको बच्चे कैसे जाएंगे 220 किलोमीटर? आप तो व्हीकल पे चले जाओगे, कार पे. बच्चा, जब आपने एक पिक्चर दिखाई थी, दैट पिक्चर इज, मैं उस पिक्चर को अभी अगर आप मुझे दोबारा दिखाए, मैं कैप्चर करके बोलूंगा कि दिस रॉन्ग मैसेज गोइंग टू द सोसाइटी. वो तो गवर्नमेंट शुड प्रोवाइड द व्हीकल टू द स्टूडेंट्स. आरटीई है तो हमको ये डिमांड करनी पड़ेगी कि बच्चों को सेफ एनवायरनमेंट में भेजिए.
सर, डाइवर्ट ट्रांसपोर्ट विल ऑलवेज बी एन इशू, कोविड और नॉट कोविड. सर, आप डाइवर्ट कर रहे हो टॉपिक को. सर, अभी बात कर रहे हैं हम स्कूल ओपनिंग की. सर,
मैंने कहा आपने मिड डे मील बोला, आप बोलो
कोविड और नॉट कोविड.
So sorry, sir. So sorry for interrupting.
Transport is an issue.
Sudesh sir, you are on mute.
we should ask safe environment for our children, and government is the most powerful entity in this country. They can provide. If we ask, we should ask कि आप मिड डे मील दे रहे हो सर, इनको मास्क भी दो, यूनिफॉर्म में मास्क होगा, चिल्ड्रन विल वियर दैट, नंबर वन. पेरेंट विल क्लीन देम एंड देन चिल्ड्रन विल वियर, नंबर वन. कोई भी बच्चा मुझको बिना मास्क के स्कूल में यूनिफॉर्म में दिखता है, गवर्नमेंट यूनिफॉर्म देती है, मास्क भी देगी. गवर्नमेंट से हम बोलते हैं कि आप उनको कम्यूटिंग प्रोवाइड करो. गवर्नमेंट स्टेट ट्रांसपोर्ट प्रोवाइड करती है, हमारे सोल्जर्स को देती है, हमारे इलेक्शन कमीशन पे देती है. तो गवर्नमेंट हैव ए पावर. इफ वी आस्क, गवर्नमेंट विल प्रोवाइड. आरटी है इज देयर. हम ये चीजों का, दैट्स व्हाई आई एम सेइंग कि हम 2022 में 2024 का प्रिपरेशन करके, क्योंकि वायरस मैं नहीं जान रहा, वट एवर आई एम रीडिंग फ्रॉम द न्यूज़पेपर एंड ऑल, दैट्स गोइंग टू हैपन फॉर अस सर्टेन पीरियड. Okay, and already academicians are accepting that the four walls and traditional classroom is not going to happen in the happy days. That's why I'm saying कि safe commuting, safe environment, midday meal की तरह उसमें number 2, जब हम आप when you are asking about the teacher should vaccinated, तो students are different. टीचर, हम गवर्नमेंट से बोलते हैं कि आप वैक्सीनेशन करो ना, जल्दी फास्ट करो, गवर्नमेंट विल डू. तो मेरा 3 डिमांड आपसे फिर से बोल रहा हूँ: सेफ कम्यूटिंग, सेफ यूनिफॉर्म, मास्क. मिड डे मील में हम पानी भी दे रहे हैं, सैनिटाइजर भी दे देंगे, हम दे सकते हैं, हमने दिया, इलेक्शन कमीशन में सब पे हम दे रहे हैं, देंगे, गवर्नमेंट देगी. आप आज तो करें. वी आर सेइंग कि हम रेडी. 2 स्कूल को देख के आप बोल रहे हैं हम रेडी. कितने स्कूल हैं इंडिया में? नोबडी हैज काउंट. आई थिंक एजुकेशन डिपार्टमेंट भी एक दिन में आंकड़ा नहीं बता पाएगा कितने स्कूल है. कई जगह तो मैडम बाउंड्रीज नहीं है, क्लासरूम नहीं है. जस्ट सी द डिफरेंट साइड ऑफ इंडिया एंड टॉक अबाउट दैट आल्सो. व्हीकल लेके 20 किलोमीटर ट्रेवल हम कर रहे हैं, बस पे कर रहे हैं. मैंने सबसे अवॉइड कर रहा है. एवरीबडी इज सेइंग कि शेयरिंग ना करें. गवर्नमेंट क्या बोल रही है? मेट्रो में 50%, टॉकीज में 50%, बट स्कूल में भी 50, तो स्कूल के ऑटो में 50. आई एम जस्ट सेइंग 3 कैविएट मेरे फिर से आ रहे हैं. वी हैव टू प्रिपेयर, और प्रिपरेशन के लिए हमको डिमांड करना पड़ेगा. आरटी है हमारे पास, ऐड मिड डे मील में मास्क आप ऐड करो, मिड डे मील में आप सैनिटाइजर ऐड करो, मिड डे मील में आप ट्रांसपोर्टेशन ऐड करो. ये कोई क्राइम तो नहीं हम कर रहे हैं आपसे. आप इलेक्शन कमीशन ने क्यों रोका कि आप लोग मीटिंग मत करो? आप कह रहे हो एडल्ट सही है. तो इलेक्शन कमीशन इज अ वेरी one of the robust and one of the future visionary institution in India. They said that like this कि election में सारी virtual meeting करें. They doesn't know the
Because
India.
adults are more vulnerable.
Yes,
They
sir,
rightly
when
said.
you were
They
speaking,
rightly
let
said.
me either complete that. That's why I'm saying I openly accepted that school has to open. Again, I am saying school has to open, but I am asking 3 things for my children. Number 1, mask should be, because बच्चा मास्क नहीं लगा रहा है, यूनिफॉर्म में नहीं है. आप यूनिफॉर्म में आपके दोस्त को यूनिफॉर्म में, जिस बच्चे को नहीं मिलेगा यूनिफॉर्म के साथ मास्क पहना हुआ, फोटो लेके प्रिंसिपल को व्हाट्सएप हो जाएगा कि योर स्कूल टीचर चिल्ड्रन इज नॉट. इस तरह का. नंबर 2, कम्यूनिकेशन हम प्रोवाइड कर रहे हैं ना, कर सकते हैं. मिड डे मील में सैनिटाइजर हो वो हम जोड़ सकते हैं. इज इट क्राइम? अगर बच्चा, टीचर एक डिस्टर्ब हुआ, स्कूल डिस्टर्ब हो गया, बच्चा एक डिस्टर्ब हुआ, 15 दिन के लिए डिस्टर्ब हो गया, उसकी एकेडमिक चली गई ना 15 दिन. तो आई एम सेइंग फुल्ली प्रिपेयर्ड. ओके सर, आप यू आर नॉट, आई एम सेइंग प्रिपरेशन इज अ की ऑफ विनिंग द स्ट्रेटजी. नो प्लानिंग इज प्लान टू फेल, एंड एब्सोल्यूट प्लानिंग इज प्लान टू विन. तो आई एम सेइंग प्लानिंग. यू आर, मैं फिर से वही बोल रहा हूँ, क्या मोबाइल ना देके मास्क दें बच्चों को, सैनिटाइजर दें, हैंडसेट देने की जगह उनकी कम्यूटिंग की व्यवस्था करें. आरटी के अंतर्गत हम तीनों चीजों को गवर्नमेंट से डिमांड करें. गवर्नमेंट के. नंबर 3, फ्रंटलाइन सोल्जर्स को, फ्रंटलाइन वर्कर्स को हमने वैक्सीन लगाई, नाउ हम इनको वैक्सीनेशन तुरंत दें. अगर वैक्सीन सेफ है, डॉक्टर साहब मैं नहीं जान रहा हूँ, डॉक्टर साहब क्यों बोल रहे हैं वैक्सीनेशन फ्री कर दो? सबसे पहले आपने लगाई होगी अपनी वैक्सीन, तो मैं लगा लूं, आप मत लगाओ, बिकॉज यू आर द एडल्ट, आई एम द एडल्ट, यू आर द चिल्ड्रन. That's absolutely, Dr. Saab, wrong, because पूरा वर्ल्ड बोल रहा है वैक्सीन इज सेफ, वैक्सीन इज सेफ, वैक्सीन इज वन ऑफ द प्रोटेक्शन. तो व्हाई वी इग्नोर दैट? बच्चे लगा, अभी कितने हमारे बच्चे, हमने कितने 134 130 कुछ फिगर्स आ गए, बच्चे कितने बच्चे होंगे? 20-30%. तो ग्रेजुअली हम फेज वाइज चल रहे हैं. 15 तक के हम कर दिया, उसका स्कूल ओपन कर दें, 15 के बाद वाला कर दें, 1 महीना और लगेगा, कर देंगे. अच्छा, 15 बच्चे बीमार हो गए आपकी क्लास में 30 बच्चों में से, तो आप 15 को पढ़ा के टीचर तो निकल जाएगा, वो 15 का क्या हो? तो that's why I'm saying, might be you are saying that I am not convincing with you, I'm just saying Give them the mask, give them the sanitizer in the mandatory in the fee structure, give them the commuting facility. आज have you courage to रेलवे भी जो है जनरल कैटेगरी, दैट जनरल कैटेगरी वाज द इंडियन रेलवे की सबसे बड़ी कैरिंग कैपेसिटी थी. दे हैव स्टॉप्ड दैट जनरल कैटेगरी. व्हाई? देयर इज नो प्लानिंग बोर्ड, देयर इज नो फाइनेंशियल वायबिलिटी. दे हैव अ फाइनेंशियल वायबिलिटी. मॉल में हर जगह थर्मल स्क्रीनिंग हो रही है. 50% सारे आइनॉक्स वगैरह बैलेंस शीट उनकी डाउन हो चुकी है, बट दे आर compelled to run on 50%. Why? Because something is there. So green pasture is not right now. The enemy is still there. We have to take a precautions. मास्क इंक्लूड करो यूनिफॉर्म में, सैनिटाइजर उनको दो. बच्चों की कम्यूटिंग की, क्लास की सेफ्टी आपने कर ली, क्लास के अंदर टीचर से सेफ, लेकिन बच्चा आएगा तो बाउंड्री से. उसके लिए मुझे किसी भी स्कूल ने बताया कि we are doing that.
Hello, sir. I'm so sorry for interrupting. But we have to take a few more questions from the audience. So I'm so sorry for interrupting. But you were correct, sir. Mr. Jaipal Kapoor, I mean, Dr. Kapoor is also correct. And so you are also correct. But my next question is to Neeta ma'am. Ma'am, are we expecting more engagement as schools reopen? I mean, now that everything has turned to digital, so will it be more difficult for students to balance now?
Balance in terms of, I'd like a little
like
more
digital and physical.
Okay, all right. See, Shivani, children have gotten used to a lot of digital exposure, right? But at the same time, most children are craving to come back to schools. Craving is the word. Craving to come back to schools so that they can be with their peers and with their teachers. The joy of learning, I think, in spite of everybody trying very hard, over a sustained period of time, the joy of learning has petered out. The fancy and the fascination that they had for their gadgetry has now started petering off. So I'm quite certain, at least for some months to come, I don't foresee that there'll be a problem of this juggling, and most children will want to come to school, provided the schools can provide give them a safe environment to be in. Most parents will want to send children to school, and definitely for the next few months, once they join back, I don't see them facing any difficulty. Because unless, of course, they are addicted, because that is also a possibility that, a lot of kids may have become addicted to gadgets. And as somebody very rightly said that, you imagine that they are taking an online class, actually they're playing a game. And the moment a parent comes in, they'll switch to their class. So there may be children who are addicted, and that de-addiction will have to happen, and that's going to be a painful process. That's going to be painful. But having said that, even on a regular given day, a lot of children who study in the affluent schools, when they go back home and have easy access to gadgets, are using it indiscriminately and are not listening to their parents. So there is a degree of addiction even there. So it's all very complicated, but definitely the numbers that may have gotten addicted may be slightly more now because of constant exposure and use of gadgets and laptops, and because it's not possible for parents or teachers to monitor 24/7. You can't do that. You cannot. It's humanly impossible. So you can only do the best that you can do. And you have to get the children to understand, taking responsibility for their own lives and their own behavior. I think that's the only thing that works. Shouting, raving, ranting, yelling just does not help. Am I right, Sanika? As parents and as teachers, I think this just does not work. Talking helps, counseling helps, treating them as adults helps. Not talking, not standing on a pedestal and talking down to them. Talking with them helps. Listening to them helps. Listening is therapeutic. Listening helps, and helps immensely. You know, a lot of children turn to gadgets and online, these platforms where you have the interactive platforms, and which may not be, which they may use irresponsibly also, because they wish to express themselves and they want somebody who can listen to them. And when they don't have a human being, you know, and in real life, parents may not have the time or the patience to listen to them. So they make these friends irresponsibly without realizing that it can put them into trouble. And that's where, you know, they start talking and they build these virtual connects. So I think it's important to listen, not talk down to them, talk with them, help them to understand that they have to take responsibility for their own behavior. You can't be monitoring anyone 24/7.
Right.
Definitely. I think that was very important because, I don't think as students we change. I think like at the adolescent time, we're very intent on listening to ourselves. So until we internalize something and we believe in the need for change, just externally hearing it doesn't really help. So, being able to have those conversations will definitely help.
Right. Thank you so much, Neeta ma'am. That was our last question. We do have many questions, but we'll take up afterwards. I mean, we can send to our panelists if audience have more question to ask. So thank you so much to all the panelists. Thank you, Neeta ma'am. Thank you, Sudesh sir, and thank you, Dr. Kapoor. I mean, it was one of the best webinar we had today. How we discussed about everything. Like if there is a pros, then there is a con as well. So I mean, we have to prepare mentally, we have to prepare physically, or as I said, transportation and everything, or the growth mindset. We have to be prepared about everything. And how it is important to open school and discuss about every aspect of students, teachers, and parents. So I think it was such a wonderful session we had today. Sanika, anything from your side, you being a student?
Definitely. I think also having moderated so many webinars, one thing that was really nice to see here is complete rounded perspectives, right? It was not just from one direction. We could like hear perspectives from a teacher, from a parent, from a doctor. And that was very important to kind of make it like a cohesive conversation and for everyone from watching this webinar to take something back. I, as a student, definitely have understood what my responsibilities are again in this entire situation, being a stakeholder myself, and how I can also enable the school to do better for myself and keep my peers safe. So definitely, thank you so much to all our panelists for making this conversation so enlightening.
Thank you. Thank you. I also must give a parting remark. I must say this is one of the best webinars that I have participated in. Why? Because it was very meaningful. I think all panelists, as Sanika very rightly said, each one had a different perspective and a very informed perspective. So it is a very, very enjoyable. Of course, I think there were moments where sparks were flowing. But nevertheless, I think that's the joy and fun of a discussion. But I thoroughly enjoyed Ms. Rupal and Shivani. Thoroughly enjoyed the discussion. And Sanika, you did great as a young person. Dr. Jaipal, I really want to take that presentation. So my personal request, sir, if you could pass it on to Shivani and Rupal, I'd like that presentation. That's going to be very useful for me.
Definitely, I will mail it to you. Sure.
G. Thank you. Thank you, Swadeshi. Thank you.
Thank you so much, ma'am. And I think some spark is always important and can light up things. So
use our but the school should open, and completely agree with Dr. Kapoor. That's good.
Thank you so much.
Thank you very much. Thanks for everyone. Thank you.
Thank you so much, everyone. And very important, it's time to announce the winner of the sharpest question, and it goes to Nikunj Goyal. And congratulations, someone from the communication team will get back to you with your voucher. So thank you so much for participating, and thank you to other audience as well. Thank you so much. And yeah. So now we have a small feedback right in front of you. Feedback form. So kindly fill it, and it's open for the panelists as well. And thank you so much for attending today's webinar. We conduct such webinar every Saturday for all our audience. Okay. And if any of your question is unanswered, you can post it by using hashtag webinar by Shah on our social media platform. We will try to get back to you and answer all your questions. And once again, thank you so much for attending today's webinar. And if you find it interesting, you can subscribe to www.schoolindia.org for our upcoming webinars as well. Also, SHAP is conducting free mental health awareness session for our school students all across India. So if any of the teacher, if any of the principal would like to conduct mental health session in your school, you can contact us at www.schoolindia.org. Thank you so much, everyone. Thank you so much to our panelist, audience. Thank you once again. Have a great evening and stay safe. Thank you. To support our work and know more about us, you can visit us on the following social media platform: Twitter, Instagram, Facebook, LinkedIn, and on our website as well. So thank you, everyone.